which is discussion and possible action regarding update from Fire and Emergency Medical Services EMS Sustainability Ad Hoc Committee. That's Supervisors Williams and McCowan. And so,
We met with fire chiefs, right?
Mm-hmm.
So Supervisor Williams and I have been meeting with various stakeholders. We did recently meet. Supervisor Williams and I have been meeting with stakeholders. We did recently meet with an ad hoc committee of the Fire Chiefs Association. A few items in no particular order. The county does continue to support ambulance service in Anderson Valley, Long Valley, and Round Valley with approximately $180,000 of county general fund annually. We've been doing that for about 4 or 5 years. The EMS system along the Highway 101 corridor, we know, is pretty precarious at times. I believe Supervisor Williams documented there were about 10 times during December when the system was at level 0, which meant if one more call came in for 911, an ambulance would not have been immediately available in the area. This board previously had authorized looking at potentially having a countywide sales tax measure to support ambulance service. However, this option was not supported by at least the administration of the cities of Ukiah and Willits. I don't know that they ever took it to their city councils to see what the opinion of the councils were, but the city administration views sales tax as one of their primary funding avenues. As a county, we are bumping up against the cap of sales tax for a county, how much it can rise above the state level. That can be lifted through a process, and I don't think it's necessarily onerous to achieve that, but the cities, again, were reluctant to go that route, and without city support, gaining a 2/3 approval for a sales tax increase would have been extremely unlikely. I believe Coastal Valley has estimated that a total cost of providing a fully sustainable EMS system might be $6 million. Other stakeholders have questioned that estimate, even if it's a high number, to fully fund a fully sustainable EMS system could be a very expensive proposition. Another thing that has occurred fairly recently is that the city of Ukiah has acquired, I believe, 2 additional ambulances. They now have 3, and they have been working collaboratively with the local ambulance company and have been doing some transports when the need for that arises. So that's something that should help with the level 0 issue. So I would invite Supervisor Williams to add to this. This is just kind of an informational update. And then Supervisor Williams has a companion item that does not come from the ad hoc, but from Supervisor Williams.
So I think the ad hoc has unity on the problem, describing where we're at, how we got here. There's a little bit of ambiguity on, or indecision on how to move forward. We know the answer is funding. Private industry likely won't solve this problem, or it would have already been solved. It's only been progressively getting worse. There's a question for this board of, do we expect to build momentum to run another tax to subsidize ambulance service, irrespective of the mechanism, whether we fund an EOA or we contract directly? Do we plan to use a tax, or do we plan to allocate some of our general fund? I understand general fund had been used decades back, and so there's already some history of the county being involved. It's also a county responsibility to provide response to 911. The interfacility transfers, moving from ER here versus to ER somewhere else, it's hospital responsibility. But when that patient calls 911 It's our responsibility to make sure a resource is coming. A lot of cases, that's not happening today. I'm trying to watch the entire county. I'm clearly more focused on certain parts that, where I live. And on Friday, I was coming home, and there's a man walking drenched along Highway 128. His car's in the river, submerged. We tried to get Parks, Fish and Wildlife, Coast Guard involved. And the folks who work for those agencies and live here do an excellent job. They're part of a great collaboration. But they don't have the state's backing to pull a car from a river. And so the next day, it was Matt Kendall and myself, Mendocino Fire, Albion Fire out there locating the car in the Navarro River, which took most of a day with a pole, just scooting around trying to find where that car is. We understood this is an environmental issue. If this state thinks straws are a problem, how about automobiles sunk in rivers? And when we finally got it winched out on Sunday, the third day, one of the volunteers who was there gave up a good chunk of his weekend, had a cardiac event. He gave me permission to talk about this. He called 911. I went to the call. It was about 6 p.m. I helped convince him the best thing to do was go to the local hospital because that air ambulance had an hour ETA. You never know if a helicopter will be able to land. Fog comes in, they have a mechanical problem. You don't want to be waiting out in the sticks. Better to be at a hospital and wait for a transfer. When the hospital finally decided it was appropriate for an ER to ER transfer, there was an ambulance parked out front. The crew was sitting next to me in the hospital. Couldn't use it. It was for 911. For good reasons. The system is designed this way. We want to keep it available for 911. So the next ambulance available came from Ukiah. Took almost 2 hours. He called 911, or his partner, who incidentally is a surgeon, wanted him at a cath lab, understood the problem. Called 911 at 6 p.m., didn't get a ride until after 11 p.m. This happens throughout the county. It's not ideal. And so we can argue about what fair response times are. You decided to live in a rural area. You're not getting the same type of services you might get in a city. I can buy into that, but I think what we have today is not working. And there are a lot of people involved in EMS and fire who are urging the county to take some action. So the companion item is just one approach. If you don't like it, we can do something else. But I picked up this card somebody left on the table here. Leadership is practiced not so much in words as in attitude and in actions. And I think that's what the public is asking us to do, take some action. We've been talking about this for a long time. This board has been involved and has taken action. The EOA, a multi-year process, the Fitch report, there's been a lot of effort in studying the problem and trying to come to a solution. I feel that we've exhausted those options, and the remaining action is to start allocating some funds to the problem.
Okay, any other comment? Supervisor McCowan.
Well, we've kind of moved the two items together. I wonder, it'll be your discretion. Do you want to take comment, if any, to 6C before we can conclude that and move on to 6D, or just take them both together?
I'd like to stay on 6B and really look at the big picture of this before we go on to the specific motion.
Okay.
Okay. Well, I'll speak to it. And I met with Tammy Moss Chandler, Director of Health and Human Services, and the people, Brian and Jennifer from Coastal Valley the other day. And I thought it was a very productive meeting in talking about what the issues are and what the big vision is for the county. I think that, we laid out like 6 different steps that need to be taken to really come up with a comprehensive plan for the county. And I think that's what we need to do, is not just piecemeal it, but really look at what the big issues are. And some of the things we were talking about were the emergency medical care community, get it up and running, really an effective group. The second one was identify or open communication. It seems like some of the agencies are holding their cards close to their chest because they don't want to give up too much right now. And so I think we need to.
Could you elaborate on which agencies?
Well, there was talk about different jurisdictions and such. So I don't personally know that that's the case, but that's what I'm hearing. And I don't
And-
want to say any names without having firsthand knowledge of that. But I hear that's the situation at this point, okay? The third one is to identify the resources and gaps that we have. Fourth is support paramedic and EMT certification program, possibly at Mendocino College. Seems like we don't, one of the real barriers to this whole problem is not having enough paramedics to service all the ambulances. And that without the personnel, it doesn't matter how many ambulances we have, we can't, we're not gonna make them run. Yes.
So, I hate to stop you in the middle of your list of 6, but as I'm hearing some of these, I don't understand a lack of paramedics. Is there an open rec for paramedics that's not being met? I don't see that as the holdup. I see the holdup as financial in nature. It's a great idea to have a training program. We should be turning out EMTs and paramedics, but I don't know that that's blocking us today. I think what's blocking us is there aren't enough units in the field, and we don't have stability.
Well, that's what I've heard from Leonard Winter from MedStar, is that is a barrier to providing ambulance service, is not having enough paramedics. So, okay. And then, the Covelo situation is critical, is that it's drawing down ambulances, and the ambulance from Laytonville has to go out to the Highway 162 if there's a call to Covelo, and a call to Covelo will take 3 or 4 hours. One of the things we're doing on it is Teresa from MedStar is organizing a meeting on February 5th. We're going to meet with the people up in Covelo and try to see what we can do about that. And then, we need a countywide exclusive operating agreement. And so those are 6 real kind of concrete areas that we need to be working on. And I just don't see, piecemealing this. I think we need a comprehensive approach. So Supervisor Williams.
So we did try an EOA. This county spent multiple years putting an EOA together. There was not one responsive proposal. And so it's not as simple as let's try to do an EOA again, right? This county needs to subsidize the EOA if it's to happen. And so I'm not suggesting that we do anything piecemeal, but we're coming up on the budgeting season. If we don't budget some funds, or if we don't initiate a new tax, talking about it won't move the needle. We're going to be in exactly the same position. I think we all understand the problem. We don't have enough ambulances responding. I don't think it's because of a lack of paramedics. I think if you have an open rec and it's market pay, you can find a paramedic. I think Coast Hospital has paramedics available. But even if that's the problem, it's not an answer in and of itself to get a paramedic training program in place. That's not going to solve the shortage we see today.
Maybe not today, but it's a long-term solution.
We could say it's a supplemental solution that should be executed concurrent with fixing the shortage of units we see today.
Right, it's one of those things that we need to be working
So
on.
I think we can find agreement there, and I imagine the other half of the ad hoc would probably agree.
I would hope we could find an agreement.
Okay, but the idea of we need an EOA, we failed at the EOA. The market told us the EOA is not a solution, and I understand why. No one in their right mind with an ambulance company would agree to those terms. The county will have to kick in some funds to pull off an EOA. Are we willing to use general fund to ensure that we have an ambulance responding in a timely manner to every 911?
Supervisor McCowan.
Thank you, Mr. Chair. Well, part of the challenge is that we are faced with many critical needs, and for those of us who've been here for a decade or nearly so, that's the constant challenge, is you can always justify the need. There's no question about the need. Where do you find the available resources? How do you allocate the limited available resources? An EOA by itself, that doesn't create any additional funding. So simply doing an EOA, I would agree, that's not a solution. we tried doing an EOA for the, essentially inland Mendocino County, and that process didn't go well, took a lot of time, including a lot of valuable staff time, some amount of money for consultants, ultimately went nowhere. The coast clearly opted out. Both North and South Coast did not want to be included in an EOA, so I don't know why we would come back and look at a countywide EOA. Another issue with the EOA is we have unresolved claims of 201 rights by the city of Ukiah. That issue's never been resolved, so unless that issue were to be resolved, you could go through the EOA process, come right down to the wire, and here's the objection by a particular entity that would have to be dealt with at the end of the process. If we're going to go down that road again, we should probably figure out a way to get an answer on 201 rights before we go into that process. The shortage of ambulances, recent cases that I'm aware of were not a failure of the 911 system. There was an ambulance available in the immediate vicinity if a 911 call had been made. So I don't know what happened that an ambulance, it may have been an emergency medical situation, but it wasn't being called that. It isn't the ambulance that makes that decision. They respond when they get the call. So it's a rather tenuous system. We know that when we've been to level 0 the number of times we have, but I wouldn't say it's a failed system. It is a system with a lot of challenges. We know we're near failure in a lot of areas, that areas struggle to find people willing to, what is it, a 12-hour shift for $30?
Anderson Valley.
Yeah, so there's a lot of challenges out there, but, and it's hard to discuss the big picture without talking about the other issue. I do have some specific comments about the next agenda item, but I do agree that piecemealing this is not the appropriate approach. One more thing I want to throw out there is I do hear frequently EMS is a county responsibility, and some of the people who say that take it to mean that the county is responsible to fully fund an EMS system. And while the county is required to have a local emergency medical services agency, and there are various other requirements put on the county, I'm not aware of a requirement that the county is required to fund the emergency medical system to any required degree. So, it's a critical need, but it's one of, multiple needs that the county is faced with meeting. And I think if we are going to direct additional general fund money, because we already, and for several years, 4 or 5 years, have directed $180,000 a year to sustain ambulance service. If we're going to do more, it should be as part of a very carefully thought out plan that identifies where that funding is going to come from or what else is going to be cut to fund it.
Thank you, Supervisor McCowan. I agree with that what I'm hearing from the fire chiefs in my area is that there is a need, and we've seen the real need, but we also need to have a plan in place. And we need to do it, they're all fine with additional funding, but before the funding comes the plan. Okay, and so let's see what the big picture is, see how we're going to implement different things, and then people would be amenable to the funding. So, Supervisor Brown.
Thank you, Mr. Chair. And you are absolutely correct. We need a county-wide plan for the entire system, and it comes from the locals too. When Bear Health, I believe that was the ambulance company that left, adjustments had to be made, and I think they're still struggling with that. And you talked about an ambulance going to the coast. Well, we're talking about, on the next agenda item, a coastal ambulance coming to the 101 corridor. But I hate, being a county supervisor, to throw a stick into a spoke while the wheel's spinning, when our emergency providers are probably readjusting. And for me, I want to hear their recommendations. It should not be coming from a county supervisor or a board of supervisors. And what information do they have? What adjustments do they think need to be made? And how can they be helped? Before I'm willing to, vote on anything that really steps in their way. I need to know the numbers and what they feel will work.
Supervisor Williams.
Yeah, so neither of these items call for a vote on allocating any county funds.
I am suggesting, you just talked about funds. I understand, but you were saying we had a responsibility. And what I'm saying is, these emergency responders countywide, were readjusting, I think, after Bear Health left. And certainly, we need a system countywide that's gonna work. But for county supervisors to step in their way,
How are we
I
stepping?
don't think it's appropriate.
How are we stepping, may I?
Let's just let Supervisor Brown finish.
I just don't think it's appropriate. I want to hear from them.
I would like clarification.
Supervisor Williams.
Thank you. I would like clarification on how we're stepping in their way when they've come to us, they've come to an ad hoc, and they've conveyed the system is failing. They
Then
need
I would like,
help.
I would like to hear that from them.
Okay.
Supervisor McCowen.
Thank you, Mr.
Yes.
Chair, and I think, we are kind of mushing the two items together, and, I do think that it would be premature to and what's the point of asking for an estimate, and you've openly called for we need to be contributing general fund, so it seems pretty clear the intention is to direct general fund towards this issue, but in a piecemeal manner and without having all the information. So we don't know yet, and this funding estimate would be transferable to Adventist Health. We don't know yet that Adventist Health is going to be managing the Mendocino Coast District Hospital. Also, another thing currently underway is the City of Ukiah has contracted for a county-wide ambulance study. Initially, it was not county-wide. My understanding, they have expanded the scope of that. The last conversation I had, they were cautiously optimistic they would have a draft of that study in March. That will provide a lot more information, presumably. And then I also think it's rather questionable to have a discussion about getting an estimate from one ambulance provider when we've just gone through a lengthy EOA process, and the only proposal that we got was from the current inland corridor provider. And if we were to get an estimate from anyone, it would seem logical you would get it from the inland corridor provider who's been serving that area for 50 years, not from another provider. And I think potentially there could be legal implications of soliciting a bid from, or an estimate from one entity when a lot of the information that the other entity used in responding to the EOA is public information. So that, kind of sets up a questionable dynamic that potentially could expose the county to liability, and I want to make sure we don't do that. I also think your comment, Mr. Chair, about the ECCM, which has, just been officially appointed and is just forming, is an appropriate venue also to discuss these matters.
Supervisor Williams.
Yeah, I'd like to give one more response before we go to public comment. And I realize we are now mixing the two issues, the two items.
Yeah.
It's unavoidable. So I would like to ask County Council, is there a legal concern about requesting information?
If I may, Mr. Chair.
Yes.
So as I understand it, the question has to do with would we somehow be jeopardizing a competitive process in the event that we were to be soliciting information from one prospective bidder? And there's a few parts here. First of all, in terms of insofar as the board previously did not act on the prior RFP and may choose to contract, I don't know that that in and of itself is going to create any basis for liability or legal jeopardy. The thing I would have more concern about would be if the board is soliciting information from one or more providers and then engages in a competitive process after that provider has already engaged in exchange with the board. That provider might be potentially disqualified from participating in the process, and there could be an allegation that if they didn't get disqualified, that they should have been, that they would either have a competitive advantage by having information that was not available to the other bidders at the time that the proposal went out, or there's also potential that they would be able to argue that they are at a competitive disadvantage. I don't want to say that absolutely creates a basis for civil liability. I would just express that it may be prudent to avoid that route to be able to preserve the integrity of a competitive process in the future. Did that answer the question?
That answered in the second question or comment is, the idea here is of the second item, 6C, is to figure out why, when I look at the books for Coast Hospital, their ambulance service breaks even. Can we replicate that model on the 101? And if not, why not? Theirs isn't costing their hospital, it's break even or better. And if that's the answer that we hear maybe in public comment, I think it opens a question of why do we have a shortage on the inland part of the county if there's a model in an area that probably has about the same call volume, maybe less, probably the same reimbursement ratios of private and public insurance.
So you're saying.
Okay.
And the goal here is to build a plan, the plan that we're all talking about. But in order to build that plan, I think we need a better picture of what we have in place today and what the financial realities are of the various models. Given that we have one entity that's public, it's easy to get the information. I think if we make a formal request, they're willing to provide us what they know, and that would be a basis for building a plan. It doesn't mean we go with them. It doesn't mean that the next step is to contract. It's just information.
Mr. Chair, if I may, it may be a little bit cleaner if we were to close off 6B and to proceed on to 6C, or if the chair's going to call them together, just make that clear for the benefit of the record.
I would say let's stay away from 6C again, as much as we can. Because, what I'm thinking of is, I think there's agreement that we need a plan. And we need to do something comprehensive. And we want to fix this situation. And so what I would like to go away from this discussion, and I'm glad we're having this discussion with the ad hoc committee, is to have some kind of tangible plan that we're going forward with, that we can investigate all these things and not have it string on for another year or two, but rather come back with a real plan at a fixed date, within 60 days or something. Because we need to we can't do it like Supervisor Brown said, we can't do it as a board here. We need those entities talking with us. Maybe we need to have a workshop, half-day session with the entities involved to work it out. But it's of critical importance to our county. And so that's what I'm looking at. As far as the paramedic situation, the CEO and I are going to be in a meeting with Senator McGuire in the college, and we're going to be talking about how to set up a program. Is it collaborating with Napa College or Sonoma, Santa Rosa Junior College, where they have programs already for paramedics? What can we do about that? But we do have a meeting planned in 2 weeks, And so we're moving forward with some of these things. I think we just need to come up with some tangible steps we can take. So with that, I'm going to open it up for public comment. Okay? Good. Okay, Andrew Hosford. Good afternoon.
Good afternoon. Thank you for taking the time. I've tried to survey a lot of people on a lot of different ideas. We've also had we've done a fair amount of bringing attention to the ambulance issue or the EMS issue in the communities, and we've gotten a lot of response back via social media, and that seems like to be a pretty good method for just getting the general public to comment. I've had people reach out to me with instant messages and all kinds of stuff showing support for the EMS issue. One of the ongoing comments that we seem to get is your constituents understand that there's a significant EMS issue in our communities, and most of the time it's more effective to go to the hospital on your own than it is to wait for an ambulance. With that understanding, I don't see how we can think that this isn't, or that we don't have a failed system. We do. Our EMS system is failing our communities, our rural communities. Rural medical care is a dynamic and very large issue that you guys are asked to address in this situation, but the solution isn't to get some specialty care to our communities. There's not going to be the funds to pay for it. The situation, or I don't know what the best resolution to this is. I don't foresee a successful, comprehensive understanding and solution to the entire community, because it's going to be different everywhere you go, as well as all of your opinions are different on this whole issue, which is I would expect across the entire community. I know that well, in the rural communities, the best way to save a life is to get somebody to emergency services as quickly as possible. How do we do that? We do that with transport. We do that with EMS services. What we're looking for is for you guys to find a situation to provide sufficient services to our rural communities. We're not going to have specialty medical care. We have to get people from A to B to get that attention. The other thing is 911 calls. We were at a staffing level 0 last night at about 7:30. It only lasted for 3 minutes. We were at staffing level 1 for a large portion of, or a large period of time. That means that there's one ambulance available for 50,000 community members. If for anything at level 2 or less, which you guys understand this, we don't have IFT, inter-facility transport. To get a person with a cardiac event, which ultimately could have killed my grandmother, and apparently it happens everywhere in the community, out to specialty medical care, we have to have that transport available, and that comes with bringing additional services to our community.
Thank you. Any other public comments? Good afternoon.
Good afternoon. Sage San Giacomo, City of Ukiah City Manager. And I just want to reiterate what has been expressed by some of the supervisors about a comprehensive plan. That's really what we need. We need that comprehensive plan. Piecemealing this will almost only assure us that we'll have the same problem today, tomorrow. And having that comprehensive plan in place is, I think, absolutely vital. Bringing the stakeholders to the table and open, transparent discussions related to this issue, I think, is also absolutely vital. The City of Ukiah has employed a consultant services to do a ambulance feasibility study that will provide us with more data with regards to the fiscal issues within the system that will help us match out what potential services we could provide and where we have gaps and if we have gaps. Having that information, I think, is vitally important in evaluating where we need to go from this point forward. So I do appreciate the sentiment that we need to have a comprehensive plan in place. The City of Ukiah stands ready and working with the county and other stakeholders on developing that plan. Thank you.
Okay, hold on one
Question,
sec.
if I may.
Okay. Supervisor Jordy.
So Saves, thank you for being here, and I appreciate what you're saying. What kind of time frame do you see that could be possible for the city of Ukiah, because you're such a big key part of this, along with the county and other stakeholders? What kind of time frame do you think, optimistically, that we could put together to getting some sort of comprehensive plan?
Well, again, the City of Ukiah has already taken upon itself for the feasibility study. We've shared that study and have met with the county and other stakeholders, Coastal Valley. It was during those meetings at the end of last year that we determined, can it be a county-wide plan or a county-wide look at feasibility, and we were successful in being able to get the consultants to engage at that level. I understand that the consultants are ready to begin meeting with stakeholders at the end of January, beginning of February, and I think we're well on track to meeting the goal of having that plan completed in the March timeframe. But it's going to, again, I think it really is. We need to recognize as stakeholders that we need to come together quickly, work together through that analysis and interpret that analysis, and then come up with a comprehensive plan. So I think that engagement is upon us.
Supervisor Jordy.
And just a quick follow-up, if the county were to ask the Coast District Hospital for the information that's on the next item, would that information interfere with or in any way harm the countywide study that the City of Ukiah is? It just seems like it would be supplemental information.
Yeah, I don't know that we don't already have some of that information related to call volumes and the fiscal feasibility of why the coast system works and why an inland system doesn't work. I don't, those are the items that are going to be exposed, I hope, through the study and the information. So I don't know that we don't already have that information that's already worked into the analysis. So I will comment. I do think that there are some potential issues from the public contracting side of it, and engaging with one service provider when there's other service providers that are potentially capable of providing those similar services.
Okay, Supervisor McCowan.
Thank you, Mr. Chair, and thank you, City Manager San Giacomo, for confirming the potential for a March timeframe for getting the results back from the countywide study currently being done. Can you also confirm that the city has recently acquired, I think, maybe 2 additional ambulances, and that you have been collaboratively responding to 911 calls when necessary? Is that an accurate statement?
That is an accurate statement. Those 2 units are not in service. The City of Ukiah just took action to get some of the necessary lift equipment that will be installed on those units.
The intention is to make them available for service? The
intention is to have better distribution of our equipment, so we're better capable of responding as needed. So at this point, we have 1 unit, but we have 3 fire stations, and so the concept is to have a unit at each fire station. But it doesn't, while we're adding units, we're not increasing staffing at this time. So it doesn't provide additional units necessarily out on the street. It just provides a more efficient model for the City of Ukiah to respond.
Mm-hmm. Thank you.
Mm-hmm.
Supervisor Williams.
What happens if you have a structure fire while a patient is being transported by one of these new ambulance units? Are you using the same personnel?
So if there's an actual structure fire, or we have an ambulance in service?
Say there's a structure fire, but 2 of your personnel who would be on that fire are with a patient in an ambulance. Is that a likely scenario, that you're using the same people to serve both needs?
We are currently using the same staff people to respond in our units. When we do staff up an ambulance unit, it does take resources out from the fire side.
What I'm trying to clarify is, although this sounds like a solution, I also read it as degraded service on the fire side for the City of Ukiah.
At this point, it's because it's additional resources, equipment resources, it provides better allocation of our resources for response that we're currently performing at this time.
Do you see it as a solution that maybe we don't need to increase the number of ambulance units because the city is stepping up?
No, I don't see that as a solution.
Okay.
And we
Okay.
haven't argued that it is a solution, so,
Thank you. I appreciate
thank
it.
you.
And yet it does provide additional resources in an emergency situation.
Right, and I understand not only the city of Ukiah is working to acquire additional resources, but I think there's also our local private provider is also working to bolster their resources as well in response. So, I think that other fire departments and others are also looking at how they could assist as well. So I think having a comprehensive plan and bringing all these stakeholders together is an absolute must to get to a solution that's going to be long-term for Mendocino County.
Thank you. And my understanding is that MedStar has donated an ambulance to the Little Lake Fire Department for their use.
That's what I
So,
understand.
okay. Other public comment?
Good afternoon, Supervisors. Tom Allman, private citizen. Thank you for having this conversation. Ambulance service certainly, and I live up north, my family lives up north, and ambulance service is critical. I'm not trying to muddy the waters. I want to remind you that this county, within our county, and I'm glad Sage is here, and I'm glad a city council person from Willis is here, we have 5 911 centers in this county. We have Willis Police Department, Ukiah Police Department, we have the Sheriff's Office, we have Highway Patrol, and we have CAL FIRE. So in the middle of January, we have 9 people working in the middle of the night when no calls are coming in. And we're talking about how much our ambulance is going to cost. We could easily save some money working with our other entities to have 2 911 centers in this county, one for fire and medical, one for law enforcement, and it would save a lot of money. And I've stood at this podium many times and said this. If you're going to have a conversation about ambulance, and whether you're talking EOC or whatever, please have a conversation about consolidation of our communication systems to save money and to make it more efficient for everyone. I mean, MedStar has their own dispatcher. I'm sure that if we said we dispatch for, or if the county said they dispatch for MedStar, Leonard would stand up here and say, hey, let's make it work, because we can do this. We're in the right situation. And Sage was talking about, let's not piecemeal this. I'm telling you, this would be a good chance to consolidate these conversations between medical services and 911 centers. Thanks for having this conversation, because as a citizen of Willits and as a friend of the Hosfords, I don't know if she would have lived or died if another ambulance would have been there, but her odds would have been much more in her favor. So thanks for this conversation.
Thank you.
Malcolm McDonald, Little River. I live on a ranch where one side of my family has lived since the 1800s. If you break a leg there, an ankle, you crawl up the hill to the nearest relative or friend. You get in the car and you drive to Willits and hope Bowen is on call that day. That's the reality in this county, or one of Bowen's proteges. And if you're on the coast, when Lago Marcino was practicing, that got shortened. You just went to him. So there's a lot, that's the reality of being in the rural area. Another reality is I'm hearing just a lot of obfuscation here from at least 3 members of this board. You have an opportunity to do something, but you'd rather form a committee to start a study, to form an ad hoc, to get some, quote, stakeholders' opinions, which are maybe real stakeholders, maybe not. And it ends up just being a runaround, and then we're still here. I'm glad Supervisor Jurdy actually asked for a date, in the question to the city manager. You people need to, we've got some people here interested in their legacies. You have, just like I told the hospital board in Fort Bragg, you have a fiduciary responsibility to vote no, like one of your colleagues, on negative money coming in month after month. You guys are, with this runaround, you're going to abrogate your responsibility to public safety right now. And it's already happened. You can't change the past. But if you're going to go down this, form a committee to form a something to form a something else, that's ridiculous. You know, I mean, it's, as I used to say to students, catch a clue. They're flying by all the time. You know, and maybe you have to do some piecemeal things. I'm sorry for the city manager and anybody else who has to have a county-wide plan. That may not be possible unless you want to wait for 6 or 8 or 10 years, and we're talking about Supervisor Williams' legacy. You know, catch a freaking clue. This has to happen in the here and now. You better get some dates. You better listen, hear from people like Davey Beek and other people who have experience in ambulances. Make them come up here and talk to you.
Thank you. Any other public comment? Dr. Matheson.
Thank you. My name is Mills Matheson. I'm the medical director at Better Creek Medical Clinic. In my 45 years of medical practice in Willits, I've never before heard so many complaints about the ambulance service from both patients and doctors. Apparently, we no longer have a reliable ambulance service. Something must be done as soon as possible to improve the ambulance service. Otherwise, there'll be more harm to our patients. The proposal to add an ambulance to the 101 corridor is a reasonable patch. It's a patch to the ambulance system while a long-term solution is worked out. I will admit that I have a personal interest in a reliable ambulance service. Several years ago, when I collapsed at home, the ambulance arrived in less than 15 minutes. I hope that the next time I need the ambulance, it will also arrive within 15 minutes. One of our patients with a similar problem was recently told that it would be at least an hour before the ambulance could be dispatched. That's what's going on now. All of us should have a personal interest in having, right now, a reliable ambulance system. Thank you.
Okay, thank you. Any other public comment? Yes, sir.
I didn't sign up for any public comment.
That's fine.
My name is Davey Beek. I run the ambulance on the coast at the Coast
Okay,
Hospital.
could you speak
And-
into the microphone
and,
and introduce
so-
yourself again?
Davey Beek. I'm the transport manager of the Coast Hospital.
Thank you.
And also a fire chief out in Comshy, a volunteer fire chief out in Comshy. I share Malcolm's frustration. Putting this into committee is not going to change anything today. Today, your constituents are suffering up and down the corridor. The time is tissue, as we talk about with a brain injury or a heart injury. Time is tissue. These people need to get to the hospital quicker. Talking about it isn't changing anything. I run a fairly successful ambulance service. We are financially viable. We do not lose money. It can be done. If anybody wants to talk to me about it, please invite me to an ad hoc meeting. I would gladly participate. I would bring my cost structure. I would, you know, I'm an open book. I'll share any information I have to help solve this problem, including resources. But I need to be invited. You all need to invite the people that need to be in the room. Honesty needs to be in the room. And we need to make a change today.
Okay, Supervisor Williams.
I have a question for the speaker. You have typically 2 ambulances on the coast,
Correct.
and that service does better than break even. It generates some revenue for the hospital. Is there something different about the inland, the 101 corridor, that would make that model run at a loss?
There's nothing in my knowledge. Obviously, it gets fairly convoluted when you talk about Medicare and partnership and reimbursement structure. And there could be a different structure for reimbursement that the inland providers are up against. So I can't really speak intelligently to that.
And if asked, would your team be able to put together an estimate in detail how you derived at it, just as a data point for us to better understand?
I have my budget. I have my costs. I can produce that easily. That would be nothing to. I would, say the word and it's done.
Supervisor McCowan.
Thank you, Mr. Chair. So a comment and then a question. So we do have an ambulance provider inland, and I kind of doubt they're losing money, or they probably wouldn't still be in business. At the same time, you're operating a service, and this item before us calls for an estimate of a subsidy. Well, if you have the here's how we break even formula, you wouldn't need a subsidy. But whatever the cost of providing the service, if you were to put on an additional ambulance, whatever that cost is and whatever the reimbursement models are for that, I don't think there's anything preventing you, and in fact, I think the consultant doing the City of Ukiah study would welcome your input, and if they haven't already, I think the city manager said by the end of this month, possibly, the consultants would be ready to begin meeting with stakeholders. So I don't think this requires any action from this board to get the information that you have.
Okay, so I work for a hospital and who works under a board. So I'm not at liberty to go out and solve the problems as I see them.
But your board would be opposed to you sharing information?
I highly doubt it if that information were requested. Currently, we have essentially 3 providers in our county. We have myself, we have MedStar, and we have the South Coast. None of which are operating at a loss, or they probably wouldn't still be here. So how is this a $6 million problem? We're looking at, we need 7 ambulances to serve the corridor instead of 5, or the 4 that are there currently. The changes are it's not that big a deal, you guys. This is a mountain's being made out of this molehill. We need to make changes, but they're not going to be that expensive. The resources we put out will make money. They may not make enough money to survive or provide reasonable profit but they will make money, and they will not sustain huge losses.
Okay. Thank you.
Thank you. Let's get this done.
Any other public comment? Supervisor Williams?
Yeah, one correction. I see 2 other ambulance providers in the room. I would love to hear from them.
Yeah, I was going to call on them yeah. Mr. Hosford.
Hi, my name is Paul Hosford. Clarification, it was stated that there was an ambulance donated to the Willits Fire Department. It's actually not an ambulance. The piece of equipment will be used as a rescue vehicle in the case that there isn't an ambulance available to show up at an accident or in an emergency case. And how that works is that one fire chief would contact another fire chief and ask for that piece of equipment to be brought to that accident. So that's just a clarification.
Thank you.
Thank you.
Okay. So we do have some ambulance providers in the room, and Mr. Winter, would you like to address some of these concerns about response time and the ambulance situation and how you see it right now?
I'd like to make one thing clear. MedStar Ukiah Ambulance has been here since 1937. We've always been here. We back up the whole county. We get calls to Point Arena, we get calls to Albion, we get calls to Navarro, we back up. We get calls to Covelo. We're the backup. We're the people you go to for the backup. We're working at this time. We're working in concert with the city of Ukiah. When VeriHealth came to us and said they were leaving, I got on, made some phone calls. I asked VeriHealth to leave one ambulance here, and they said they're done here. The city, the chief, the new chief at the city of 1 year, I've known for 6 years now. And they're working with us, and like Sage said, they're acquiring a few more ambulances. When you see the level 1 come down, they're still the city ambulance. They still have theirs. The level 1 is just with MedStar. But the biggest problem that we're having, I think right now, is what's drawing us down. It all comes to Covelo. Covelo has what the ambulance people are calling the X factor. It takes one out of the system for anywhere from 2 to 4 hours, and we're doing 19, 20 calls. We did 15 calls up there last month. 6 of them were dry runs and 9 of them were transports. They're trying to get them on the radio. I don't even hear them responding hardly anymore. Covelo. I think that we need to take care of Covelo before we take care of anybody else. We've got an hour and a half from Willits. When that Willits ambulance leaves, that it takes another one out of the system in Redwood Valley. So we need to help Covelo. We need to get something situated there. We do have a meeting there. Where that's going to take us, I don't know. But I think if there's any funds that need to go anywhere, they need to go to Covelo. And we need to get help up there for those Covelo people. They're drawing down the system 15 times a month. And it takes us out for many, many hours. The next problem is Willits. In December, we had, in Willits, we had Teresa, my operations manager, is probably going to get up here and correct me on every one of these numbers, but Willits, we did, it was 115 calls, 911 calls. Well, let's subtract the dry runs. The dry runs, non-transports were 37. And then we had 2 1144s and 4 AMAs. So the total number of calls in Willits was 73 for 911s. The city of Ukiah, the calls within the Ukiah Valley is subsidizing, we're subsidizing, and the city subsidizing Willits with the calls that we receive in Ukiah. There's not enough calls in Willits. I don't know where David gets his numbers, but they're not going to add up. I was hoping these numbers were good. The last time I did one of these studies was, I was out of the ambulance business for a few years, but was requested to come back for different reasons. But I've seen these numbers, and these numbers are the same they were 15, 20 years ago in Willits. I've seen them down to 50 calls in Willits. It's a tough call up in Willits. If we go to the transfers up in Willits, we did a total of 54 transfers. But some of those transfers were contracted to us through mental health. I forget if that was, I got two numbers here, 6 and 11. So that brings the transfers down. The Ukiah Valley is subsidizing the Willits ambulance the whole way. We couldn't even be up there if we didn't have Ukiah. I think the help needs to go to Covelo right now. So let's look at some numbers here, because some of you want to see this. So in 2018, I've come up here for the last, I don't know, it seems like I'm coming up every quarter. And last time I was here, I told you in the first quarter that the Medi-Cals have gone up to like 58%, and the Medicares have gone down. So in 2000, and I'm going to go to 2018 real quick here and just give you some numbers. In 2018, we did 2018, we were at, Medicare was 40%, Medi-Cal was 44%. The Medi-Cal is caught up. It used to be, for years and years, we were at 59% Medicare and 28% Medi-Cal. So in 2019, we went from Medi-Cal, where's that number? Right here. So the Medicare has gone down to 39%, the Medi-Cal's gone up to 41%. And here I'll throw a number out here to you that's gonna boggle your mind. In 2019, we billed out $10 million, 188,507. And I don't have the final number on that one, but on 18, we billed out $9,186,327. And we collected about 1.8 million.
Okay.
We have 4 ambulances on, 24/7. We have 1 ambulance that comes on. So far, we've managed to put one on the weekends, a 5th one. But without the city backing us up, or not backing us up, working in concert with us, we would be in trouble. But I think our main concern right now, at least in my mind, is Covelo. It's the X factor. It's taking one ambulance out of the system all the time. We need to help Covelo
Okay.
and Laytonville. Laytonville has one person on that's at the station, a paramedic, with a call-in EMT. I'd like to see some funding get to them and get an EMT there 24/7, so they're ready to roll. And there is a shortage of paramedics throughout the whole state. Davey may have a lot of them. They pay him a little bit more money than everybody else. We've got our rates up there. I can't give you a number right now, but I think we're spending 16 per ambulance per the employees only between $1,600 and $1,800 a day for that paramedic and that EMT to be on the ambulance. That's not counting the ambulance. That's just for the wages, the benefits, and the workman's comp and things like that.
Okay. Thank you, Mr. Winter. Can you, hold on one sec. Can you state your name for the record?
Leonard Winter.
And we have some questions for you too.
I'd like to say one more thing real quick if I can. Davey beat me up on those, talking about my old ambulances at the last fire meeting. He tried to do it politely, but it still was a joke. But I'd like to say one thing. There's only one ambulance company that I know that has left their district without an ambulance, and that was Fort Bragg. When they went on strike, we had to go over there and cover for 2 weeks to a month. MedStar Ambulance was over there, and we took care of every single call for them because they didn't have any ambulance because their medics went out and strike for more money.
Okay, thank you. Supervisor Williams.
Yeah, just so you know, none of these questions are to be critical of any ambulance company or put one against another. I think we're just recognizing that there is a problem, and I think all of the ambulance services are struggling to try to meet the need, and probably struggling in slightly different ways. So when you talk about Covelo, without a public subsidy, without local government chipping in, do you see a way for your business to staff up and provide that extra unit to satisfy Covelo and maybe Covelo/Willits?
Well, I was hoping somebody would ask me that. We were in Covelo.
Yeah.
We got a resident paramedic in Covelo, and I don't remember how long we were there. Teresa's going to get up and speak next. She can tell you. We were asked to leave Covelo.
By who?
I don't know if it came from the county or it came from EMS.
Well, the county...
They walked into my office and said, here, you sign this piece of paper. You're going to back up Boonville, and they're going to back up.
The county and my understanding, even the LEMSA have no oversight. Other than if you're providing ambulance service, you have to keep one unit in county. I don't think they can tell you where you can play.
They wanted me to sign an agreement that we were going to go to Boonville, and they had the other company sign an agreement they were going there. So we left. It's not going to work up in Covelo. We had a paramedic there 24/7, 6 days a week. The subsidy came out. I said, well, great, we'll get subsidy. We'll get that seventh person up there because this lady would like to go to church and have one day off. She was working in the clinic at the tribal clinic 4 or 5 days a week. The tribal clinic would pay her and would let her go out with us, and then we'd take over at night and pay her.
Right. In your expert view, and what I'm getting at is Supervisor Brown's concern, which I think is valid. If we do nothing, if this county fails to act, do you believe the ambulance service will stabilize countywide on its own? If we leave it to the ambulance providers to do what they do, will we have an adequate level of service that meets public expectations?
I think it depends on what area you're talking about.
The entire county.
Well, I think Ukiah will always take care of itself.
Yeah.
And we've always, when I've been at the helm of MedStar and Ukiah Ambulance, we went back and forth to Willits several times. When everybody would leave because there wasn't enough money, we'd go back and subsidize with the calls from Ukiah.
Do you think we have a shortage today?
I think that you could take a lot of off of us if you get some help up in Covelo. So there is a shortage, I guess, up in Covelo. I don't know what Covelo's doing. I've been on the phone several times and I couldn't even get an answer from them.
So that sounds like one of the problems this board could take up is how do we provide service in Covelo so that you can keep that remaining rig in service in Willits?
When we use it, if we're using it 2 to 4 hours, it's out of service. Sometimes they get back up there in Covelo. we're hundreds of hours we call it unit hours. That unit is in service up there for 150 to 200 hours every month.
Got it. And has the county ever subsidized your ambulance company?
Every ambulance company in Mendocino County was subsidized. The subsidy started the subsidy started back in 1955. Is when we got subsidy. We would get a stipend every year, 20 to 30,000. Doesn't sound like much. I don't know if it was that much in 55. I was riding in the ambulance, but I wasn't doing anything in it. Anyway, we have, I know at the end of the subsidy, it went from 55 till about 89 or 90, that we got a subsidy for just to be there every year. We got paid for dry runs. We got paid for some bad debts. Plus, we had a subsidy with the city of Ukiah, though it wasn't very much. It was more of a token that we would be there. And we did. Every ambulance company in the county got a subsidy. When the subsidy stopped, that's when the problem started.
Thank you. That's exactly what I was looking for.
I had questions of the speaker also.
Yeah. Supervisor McCowan.
Had I been called first, my question was, what's your solution for Covelo? And I don't think we're going to design that here today, but do you think that the ECCM committee, which there's a lot of experience brought together there, would that be an appropriate body to have a workshop on brainstorming? How do you address Covelo? What's the best way to do that? What would it take?
I'm glad you asked that. I was going to bring that up. I think everything needs to go through the EMCC committee. They're the ones that know it. The nurses know it. The paramedics know it. All my staff knows it. It's been a good committee. I don't know what happened to it. I was on that committee 20, 30 years ago. We got things done back in those days. It was a good working committee. Everything came out of the committee. We had our health officer would always come to the meetings, and it worked out great.
Thank you. And then one other item I wanted to clarify, because we've heard the comment, gosh, they're transporting these mental health patients in ambulances, and that's true. And I think part of why, and there obviously could be a more cost-effective method. An ambulance is not required for most of these transports, and yet I believe you get reimbursed for the ambulance transport, which helps sustain the rest of your operation. If those patients were transported by another means, you would be losing that revenue. Is that more or less accurate?
I think that I know that the mental health got us through the hard times when there was 2 ambulance companies here. It's probably what saved us and kept us moving. With the contractor of the mental health before the current contractor, we did use we don't call it a cage car, we call it a secured car. And we transported, I'd say 90% of them that way, and it was just fine. And
were you adequately reimbursed for that as well?
Yes, by the previous contractor himself, not through Medi-Cal or Medicare. But most of them are Medi-Cal. So we're doing, I'd like to see the secured car come back. We have met with Redwood Quality Assurance, and they've almost cut back almost to zero the extended long hauls to Reading and Red Bluff for those patients. We still do a few, but very few now. And we'll probably be meeting with them again next week. And I think that everybody's looking to partnership and Medi-Cal to see if we can get reimbursed for that secured car. We would have to purchase another secured car. That would cut, I think if those patients were transported by the secured card, I think that the 101 corridor, if Covelo gets some assistance, that could be covered at all with the 4 ambulances that we have. We may be going to 5 ambulances. We're looking real close at that. We're doing it on the weekends. We're just trying to find the personnel to cover it right now. It may go to a paramedic in the daytime for 12 hours and then drop off to just EMTs.
Thank you.
Okay. Thank you, Mr. Winter. Okay. When is the next Emergency Medical Care Committee. Who knows? Thursday. All right, so the solution is here by Friday.
Yeah, okay. Good afternoon, Teresa Gowan, MedStar Ukiah Ambulance. So if you have any questions about what Leonard had, just ask me. Apparently I clean up. So I have a couple things I'd like to address. First of all, we do not have just 3 ambulance providers in the Mendocino County corridor. We have 4 ALS providers and 2 BLS providers. Without those BLS providers, it would actually weigh down our system a lot more. One of those is Covelo. We are in Covelo a lot. 15 calls may not sound like a lot, but like Mr. Winter said, it's a lot of hours that we're spending going up to Covelo, and it does draw down our system. When we send an ambulance up there and it takes a long time for a decision to be made whether the patient's going to be flown or whether they're going to go by ground ambulance, that ambulance is tied up. They can't just cut loose to go to another call. Sunday was a good example. We were at level 1. There was a call in Covelo. I was on a call out Montgomery Woods for 3.5 hours, way out there. Another ambulance was on a call in Ukiah. We kept getting back-to-back calls in Ukiah. We took a stat transfer to Queen of the Valley, which was a cardiac patient that had to move. So when the call came out in Covelo, that one ambulance that was available for the 101 corridor was pulled into Covelo because nobody could fly. About 20 minutes into responding to that call, the ambulance was staged along the 162 highway for Covelo to make the decision on whether or not they were going to transport the patient, leaving us at level 0 for an extended period of time for one patient that may or may not be transported because the decision isn't being made. Like Supervisor Haschek said, I have set up a meeting with Covelo Fire, Round Valley Clinic. Sheriff Kendall will be with us also. Supervisor Haschek and us are going to meet and see if we can figure out how to make things better for Covelo. They're doing an amazing job with what they have, but they don't have a lot. They have 3 EMTs and 4 non-EMT drivers. To run an ambulance service 24/7, they need help. With helping them, it will help the 101 corridor. Currently, we're running 4 ALS ambulances 24/7. With the additional 5th ambulance when I have the staffing. I will have to disagree with you, Supervisor Williams. There is a nationwide paramedic shortage when the biggest company in the state of California, who is AMR, is offering a $5,000 sign-on bonus to get paramedics because they can't staff. It's not just a small company not being able to pay the wages to the employees. We need to get our paramedic program back. A lot of our paramedics are going to fire jobs because fire jobs are ideal. You don't have to transport patients. You can make more money as a paramedic. We need to bring the program back. I went to this program. I stayed in this county. I didn't go anywhere. I've been here since the age of 2. My family's been here since the 1800s. Carrie and I go way, 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 way back. And I'm not going anywhere. So if I'm not invested in this, nobody's invested in this. I want to see our system built better. It is broken. It's been broken for a long time. When VeriHealth left on December 1st.
Thank you. Okay,
Am I done?
Please,
Okay.
just wrap it up.
Okay.
Yeah.
So we need to fix the system. There are things that we need to fix, and I think we need to get together. The EMS ad hoc committee is an amazing idea. I hope you would invite the EMS providers who are currently providing services to sit on that committee and give our opinions and ideas on how to fix it.
Thank you. Oh, question.
So you have a meeting on Thursday, and you're going to Covelo very soon. How quickly do you think you could help come up with a proposal?
For the county?
Well, it may be a bit of a maybe a bit of a patchwork, but I mean, you know, something to be tangible that the county could do to. If it was a subsidy, it's a subsidy. How soon do you think that could come forward?
So currently, you guys are already providing $66,000 to the providers who need the assistance. Covelo, Anderson Valley, and Laytonville. That does take a lot of weight off of the system. Anderson Valley is able to provide their EMTs some type of subsidy to be able to staff their ambulances. They're struggling. Laytonville provides an EMT to run with their paramedic to provide the ALS services. They need some help. Covelo, like I said, they're short. They need help. So I think the funding, if it's going to go anywhere, it should go to the outlying areas to help support the inland so we're not pulling ambulances out. How long do you think it's going to take? I have no clue. I don't know what Covelo is going to ask. Do they want money? Do they want classes? Do they want us to send an EMT up there or a medic on weekends? I don't know. It's a great question. I would hope within the next month or so we could have an idea on how to fix the system, but I'm not sure.
Supervisor Williams.
Do you agree that in order to fix this situation, funding is necessary?
It depends on where the funding is going.
Yeah, but
I think
is
that
it,
funding of the rural areas who are struggling to help support the 101 corridor, yes,
is it possible to fix this situation without funding?
probably not.
Okay. So one of the, I want your input on this. It's not a trick question. So one of the difficulties I'm having is I've been watching this process unfold, I think. When did the Fitch study happen? Was that 2012? So over 9 years. And it's been 9 years of let's have meetings, let's get fire people in the room, let's get ambulance providers in the room, let's, send it out to this committee. And we haven't gotten anywhere. The situation is worse today than it was 9 years ago. So it may be that it's the direction we have to take. Let's get a group together. But I only want to do that if funding is a possibility, because if we just get a group together to talk about creative solutions for addressing the rural outlying areas, not backed by any public money, I don't see how we're going to make progress. We've gone through that exercise N times. Would you agree, or do you think it's worth the exercise even if money isn't on the table?
Well, I think we need to find out how much money we need to put towards it before we can ask for a certain
And
amount of money
what-
to fund it.
Agreed. Why do you think that hasn't happened in this 9-year period of the Fitch report, of the EOA? Why are we still talking about this a decade later?
That is a great question. I don't have the answer to
Do you,
that.
do you think it's on the county side? Like,
I-
where is the breakdown?
I don't know. I don't know where the breakdown is. Can I address the level 0 really quick before I leave?
Of course.
Okay. So
Supervisor Williams?
Let me ask you a question. Can you
Okay.
explain the level 0?
Sure. Okay, so currently we have a system status management plan for the 101 corridor. Only the 101 corridor. It does not include the coast at all. So the 101 corridor goes from Kaminsky Station Road south all the way up to the Humboldt County line, over to the Lake County line, and into Anderson Valley. When we are at full staffing, MedStar, as we said, have 4 ALS ambulances 24/7 with the additional ambulances added in as we have staffing. When we get a call and it drops to level 3, there's no notification any longer, because level 3 is still sustainable. You have 1 ambulance in Ukiah, you have 1 ambulance in Redwood Valley, usually. There may be 2 in Ukiah, and then 1 ambulance in Willits at that time. When we drop to level 2, that means there's 2 ambulances on the 101 corridor. So there's 1 ambulance in Ukiah and 1 ambulance in Willits at that time. That's the positioning for those ambulances at level 2. And those are MedStar ambulances. Those aren't any other providers. Those are just solely MedStar ambulances since the exit of Falk in December. When we get to level 1, that MedStar ambulance is moved to Redwood Valley as it's centrally located to either go north or south, whichever is needed for a 911 call. When we go to level 0, that just means that MedStar no longer has an ambulance available for a 911 or an interfacility transfer. And then we have the Ukiah City and Laytonville, who in collaboration with us will run 911 calls. This gives both ends of the county still having coverage. Ukiah will remain in Ukiah. Laytonville moves down to 162, where we've been promised to have a coffee station put in soon, so when we're staging there, we can have at least coffee. And a porta potty per Chief Carberry. So that is what our system status is. When we go back to level 1, that means a MedStar ambulance has come available. So even when we are at level 0 on the 101 corridor, there are still ambulances available for 911 services. They're just not MedStar ambulances at that time.
Is it possible to do a transfer during that period?
Transfers are suspended at level 2 unless they are stat transfers. Yeah, so those 2 ambulances are left for 911 or stat transfer requests. Stat transfers have very strict guidelines on what a stat transfer is.
All right. Thank you.
You're welcome.
Okay. This has been a good discussion. Yeah, if you want to make a public comment, come on up. State your name.
Dr. Debbie Marks. I'm an emergency physician who's been
Into the microphone.
I'm an emergency physician who's been practicing here since 2006. I would just like to say that since starting this year, it has become increasingly difficult to take care of patients once they get to Willits or to Ukiah. We have to remember that Willits is a critical access hospital and does not actually give a lot of services that are that our community needs, and they need to be transferred to a higher level of care. And those patients are getting delayed. As Teresa said, level 2 stops the transfers. So even when you get the patients to us, we can't get them to care, definitive care. And patients have been harmed by this. We've seen it over and over again. It has become very difficult, and I'm sure that that's why Dr. Matheson is here today as well. So I would, when you said, is there a shortage? Is there a problem? Yes, because when you have those 911 responses, that's great. They come to a critical access hospital or to Ukiah. I practice at both, where, again, we have limited services. We do not have a lot of specialists, and they need to go outside of our 2 hospitals. We can't get them there. They have been delayed hours to the point of deterioration when we then try to get a critical care helicopter, which is also delayed, right? So it's been a problem. Thank you.
So hold one sec. Supervisor Williams.
So I've received some criticism over my agenda summary where I'm claiming patients are actually harmed by the current system and that they can't get the appropriate level of care, that the transfer is not timely or the 911 response isn't timely. Would you say that's accurate, not just theoretical, but that it's happening today?
Absolutely.
Thank you.
I think that Amy Buckingham, Rebecca Danao, Lindsay Spencer would all be able to back those with real cases. And I know personally I've had those cases.
Supervisor McCowan.
Thank you, Mr. Chair. Could you differentiate between interfacility transfers and stat transfers?
So interfacility transfer, so this is, you have to think about this in terms of, we have a patient who needs a bed, maybe for a medical problem, right? We don't have a bed at Ukiah, but there's a bed at Howard. We've gone both ways, right? The patient can be stabilized in our emergency department, but will be much comfortable when they aren't sitting on an 1.5 inches of foam. That's different than a trauma patient or a stroke patient that could benefit from intervention, or some other, or GI, because we don't have GI call. Those patients need immediate services, but those patients are still being delayed, often hours, for definitive care.
My understanding was that when we go to level 2, then the interfacility transfers are on hold, but a stat transfer could still be called for and an ambulance would respond. Is that not accurate?
So you have to understand what you're now asking our people to do. Are you going to take a patient out of the system, I mean an ambulance out of the system, for a transfer down to St. Helena or a transfer down to Santa Rosa from Willits? So that's a 3.5 or 4 hour turnaround, right? It's an 1.5 hours down there. And how stat is stat? I felt the patient needed to be stat transferred, and the nurse manager in the ED was saying, well, but it's going to take the ambulance out. We're down to a level 1. We can't do that, right? And so you have these moral and ethical dilemmas. I'm going to tell you, it's made it very difficult.
But you, I would presume, would be making your decision on what's the best interest of that patient that needs the trauma
right?
care.
I did, yeah.
Well, then you'd call for a stat transfer, I would
We
think.
did, right? And then we took, and then what's the impact from every other person who might need to have a 911 call? It's made it very complex and complicated.
Thank you.
Yes.
Thank you. Any other public comment?
We do have
Okay,
our.
excuse me.
Oh, if I may.
So, we have 5 more minutes before we're going to take a break. So this might be a good time to take a break and then come back with some solutions or steps, next steps, because that's what we need to look at this point. So,
Unless someone absolutely needs a break, why don't we just,
Well-
and maybe someone does, otherwise I would think we'd stay
I
with
think-
the item.
well,
Which item are we on?
we're on 6B.
Oh, are we?
Yeah. We're on 6B. We're talking about the whole big picture still. Okay? So let's take a 10-minute break, and then we'll come back. All right, we're back in session. Okay. Thank you, Supervisor Brown. Supervisor Williams. Okay. All right, thank you for coming back. And, you know, some people we haven't heard from yet are this Coastal Valley EMS agency. So if Jen and Brian, would you like to say anything about this issue? And then we'll move on to next steps.
Chair Haschak, members of the board, thank you. Jen Banks, representing your EMS agency for Mendocino County. We've covered a very wide array of EMS discussions in a very short time frame today, and I appreciate everybody's time and attention. I look forward to working with the ad hoc committee moving forward, as well as our newly constructed EMCC group that meets this Thursday. I'm here to answer any questions, if there are still some.
Supervisor Williams.
I'm always good for a question. You heard my comment that I've been following this for years, and I've seen we keep meeting and recirculating ideas, and we haven't made progress. What do you see us doing different this time? Is it just a funding issue?
It is, in the rural parts of Mendocino County, yes, I do think we have a funding concern because often in EMS services, where the core population exists is where your funding mechanisms to maintain a sustainable EMS system exists. So yes, I think we need to really explore the greater rural parts of our county in an effort to possibly financially support greater infrastructure for EMS services to those locations.
And you're familiar with the model on the North Coast that's better than break even. Do you see any reasons why that model wouldn't work on the 101 corridor? Why are we running losses over here? And if we're not running losses, I would think we could scale up back to the 7 units we had a year ago.
I do believe that question is better directed at the providers themselves. I do not have any overview or oversight to either agency budget or structure. I will say in Fort Bragg, they do run at a lower resource volume, so they're running usually 1.5 ALS ambulances a day compared to 4. That is a pretty significant cost increase when you're looking at an agency budget.
Got it. And I would think there'd be an economy of scale, though, that if you're running 4 and you add a 5th, that it would pencil out better than.
Again, I'm not privy to their budgets, so I'm not going to discuss that.
Did Coastal Valleys, or to your knowledge, did any government entity ask MedStar to not cover Covelo?
Yeah, I would like to clarify what happened there. So I believe it was probably about 6 years ago, we came to the board and with support from the executive office, the HHSA department, and Coastal Valley's EMS agency, we were exploring a mechanism to support EMS services in the rural part of Mendocino County, and we came up with the ALS Enhancement Fund. That was approved and supported by this board, and it has maintained support over the years. In bringing this fund forward to our EMS providers, it was discretionary to each EMS provider in the rural parts of the county who they wanted to enter an agreement with to become service partners. At that time, the Covelo Fire Department did enter an agreement with Falck VeraHealth, and that is how that relationship was formed. That was not a decision made by Mendocino County or by Coastal Valley's EMS agency.
And what action would you like to see us take today? What do you think would be the most successful to get us on a path of resolving this?
Thank you for asking that question. I think it's really important that the EMS ad hoc committee before us today understands that there are a lot of providers in the room that want to participate in future EMS ad hoc meetings. They have not taken place. I have not attended one in a very, very long time. I think I've only attended one in my 7-year history with the EMS agency in Mendocino County. Furthermore, I think we do have a wonderful opportunity with the the new EMCC committee to really explore these issues. We're getting into the weeds here at your podium today, and I apologize for that. I think we can really rely on our EMCC group to get into the weeds on the issues and the discussions that we need to have at a greater level, and then return to the board with a more formal presentation on ideas and momentum coming from that group. That is a starting point.
Thank
Thank you.
Okay, we have some questions. Supervisor Jurdy.
So earlier today, I think someone said that nothing had happened in Mendocino County since 2012 Fitch Reporter. I know that's not true because I've seen changes just during the 7 years I've been on the board. Subsidies that the county previously had not offered was offering to Anderson Valley, Laytonville, Covelo. So I know that things have changed and evolved over the last several years. It's not been stagnant, zero, no change. My take of this is that we live in a changing world with changing reimbursement rates, a federal problem with Medi-Cal reimbursement rates being too low, and this is a problem affecting all of rural America. My research shows that this is affecting all of rural America, not just unique to Mendocino County. But what kind of time frame could you promise if you perhaps had access to the ad hoc committee that I'm not a member of, but I know we have 2 members of it? If the ad hoc were to meet with people as quickly as possible, how quickly do you think that people could come forward with some kind of recommendation?
I don't know that I have a time frame answer today. I mean, building an EMS system is very complex. We've addressed some of the basic fundamental issues present in our county today. I do not think this is going to drastically change in 30 days, 60 days, or 90 days. Unfortunately, that is very hard to say because we have a public that is expecting immediate change. The best we can do right now is we're really structuring out the meetings and the opportunity to have greater discussions. I do appreciate the recommendation that if there is any funding available from the general fund, that we need to try to capture that early on so we have something in place for the future budget. But unfortunately, without a system built, we don't know what that financial budget piece looks like to date. I would defer the question back to the ad hoc and this board, as I am staff and I'll take recommendations to execute projects and return anything to the board that is requested. But when it comes to a time frame, we have to really start beginning to have the greater discussions. And I hope those begin this Thursday at our Emergency Medical Care Committee meeting.
Okay, Supervisor McCowan.
Thank you, Mr. Chair, and I appreciate your comments. But instead of the EMS...
Microphone.
Oh, excuse me. Instead of the EMS going out and gathering people together, it seems like the EMS ad hoc should go to the EMCC where everybody's already gathered.
Yes.
And have the discussion there. And I do think we are going to be getting new information fairly shortly. It is not, I do not believe, a given that Adventist will be managing Mendocino Coast District Hospital. They may, but that's not assured yet. And we do have confirmation from the city manager that they are hopeful that they'll have the results of their study in March. So there's quite a bit of information potentially coming forward in a short time frame. So, and I believe you and others have highlighted the EMCC as an appropriate venue for a lot of these discussions to take place, because that is where the most knowledgeable people who are providing the service are all gathered together in one room.
Correct.
And for that reason, I do tend to think that, well, when we get to the next item, it might be a little premature, and getting a more comprehensive view of the overall system before we start figuring out what is the next Band-Aid approach would seem to be more appropriate. I don't know, do you have any general thoughts on any of that?
I would love to put this together in a formal presentation, but just to touch on a few parts of our system that were brought up today, but I think we missed capturing the big picture. We currently have 8 EMS providers in Mendocino County. I've heard different numbers each time we come to the board. They are Long Valley Fire Protection District, Covelo Fire, MedStar, Mendocino Coast District Hospital, Ukiah Valley Fire Authority, Anderson Valley Fire Department, Coast Life Support, and Elk Volunteer Fire Department. All of those agencies provide EMS transport resources to Mendocino County, 5 of which are ALS. That's our Advanced Life Support paramedic level providers. We do not have 2, we do not have 4. We have 5 ALS providers available to provide transport services by, actually, and I do have to add AMR to that, they are permitted to provide service in this county, although they're not integrated into our daily operations. So those are the current service providers that we have available today.
Okay. Supervisor Williams.
Well, I think we're finding some unity here. It sounds like I want your feedback, Jen. A proposal might be that the board's ad hoc meet with the EMCC, document the current state, get everything down on paper so that all 5 board members have the access to the same information about what we're working with, and maybe come up with 2 lists. One is a short-term Band-Aids, because we know the longer-term solution will take time to put together, and then a longer-term plan that looks holistically at the entire county, that doesn't attack this piecemeal. Would you support working with us on that?
Absolutely.
Supervisor
Thank you,
McCowan.
Mr. Chair, and I believe I heard you say you would love to give a formal presentation, and you just had some kind of off-the-cuff remarks. So maybe one approach would be for the EMS ad hoc and the EMCC to basically have a town hall type of meeting where we would hear presentations and public comment. And the EMCC has a history of meeting in very cramped quarters. So part of my thought in having a town hall type of format would be a larger venue where the general public would be able to participate, hear everything that's being discussed. Do you see value in that approach?
I definitely see value in that approach. I would like to hear feedback from the public. We are getting a lot of calls. There are a lot of people interested in EMS services in our county. It's a hot topic right now, and I think the better we can provide opportunity for people to come together and have a discussion, the better our outcomes will be as a greater whole.
Thank you.
Thank you.
Yeah, and another approach that I've heard is that we could have a whole board workshop on this, some, half day, and have the EMCC and the whole board and whatever other stakeholders want to come in and just talk it out in a Brown Act open setting. So it doesn't matter to me which way we go on this. But I think both of those have validity.
I would support either.
Yep.
Okay. Yes, CEO Angelo.
Chair Hashak, just for clarification, just because of something Jen said, I wanted to be clear. Are we talking the fire and EMS sustainability ad hoc? Is that what we're talking about? Okay, because we've had, multiple ad hocs, and we've also had multiple working groups over the last few years. So it would be then Supervisor Williams and Supervisor McCowan. Is that right?
My understanding is we would work with Coastal Valleys and with the EMCC to collect the data, put a presentation together, but we want all 5, we want a Brown Act compliant so that all 5 can watch.
But as far as Supervisor McCowan suggested going to EMCC, which I believe is this Thursday,
Correct.
Is that right? And so it would be this ad hoc, it would be you and Supervisor McCowan that would go to EMCC and work with EMCC. And whether you do a town hall or a workshop, it's the full board, and that's fine. That makes perfect sense whichever way you go. But I just wanted to be clear because we have had multiple committees over the last few years, so thank you.
Thank you.
Supervisor Jurdy.
So just to restate that, so on Thursday, the ad hoc will meet with the EMCC, but then following that, the entire board will have a special board meeting, perhaps with the EMC, in a town hall meeting, and like maybe a special workshop evening.
There may be some intermediate steps or meetings between those two. The idea is to come organized to that town hall style meeting so that we have all the facts present from all the providers. For example, it would be great to have a chart going back a year's length of the ambulance level, how many were stocked, assuming dispatch has this. I think that would be helpful. I think, I tend to listen to the scanner. I have an idea when I hear there's not one available or it's pending on another call, whereas Carrie may not be listening all day, may not be, I heard her today ask about level 2. And the idea is all 5 of us need to have the same information to work with before we talk about funding a system.
Okay. How about if we come back, well, the ad hoc is going to go to the EMCC, and then come back February 4th and provide a plan for how we're going to outreach to the community, how we're going to have, whether we're going to have an open workshop, presentation workshop, whatever it is, come back with a plan for that. And in the meantime, we're going to have, well, on February 5th, we're going to have this meeting in Covelo. And I think January 31st, the CEO and I are going to have that meeting with the college and Senator McGuire, talking about some of those long-term issues too. And so hopefully we can start getting our hands or heads around some of these big issues. So is that a plan going
Well, I
forward?
don't disagree, but I don't know that February 4th is the right date. But as soon as possible, when we think we have the appropriate information to share, and maybe that's February 4th,
Well,
but
you
maybe
don't
it's
have
the
to-
next
no,
meeting.
You don't come back with the presentation February 4th. You come back with a plan to move forward. Okay? And so it could be, hey, we're going to set up a special meeting. We're going to, block out this date or whatever, so that we're all on board. Is that good enough?
That works.
Yes, teacher.
Okay.
I'd like to
Very
make
good.
one final comment. With all the meetings you just announced, I really want you to understand that the EMS agency is happy to participate in all of those meetings, should we be advised of when they take place.
Okay, very good. Thank
Thank
you.
you.
All right. So we're still on 6B. Do we have a plan moving forward, I think? We're all in
Would
agreement?
you repeat
Okay.
the directive for staff, perhaps, if that's what it is?
Well, okay, so the ad hoc EMS, or
Would you
whatever
like-
you're calling yourselves,
Would you like me to repeat it?
you guys are going to the
The-
EMCC meeting tomorrow or Thursday.
Chair Hashtag, I apologize. I just have to be so clear on this because there are so many committees and whether it's the staff or the public. So if we could be, as part of the motion, that it is it's the EMS and fire sustainability ad hoc.
Yes,
Please,
that
thank
ad
you.
hoc is going to attend the EMCC meeting on Thursday. At that point, you're going to discuss the whole issue, and you're going to figure out how to move forward.
With
Whether
a
it's going to
plan.
be a presentation, a workshop for the board, whatever it is, sometime in February, hopefully.
Well, I think the directive then is that we would report back on February 4th.
Right. Report back on February 4th. In the meantime, the CEO and I are attending this meeting with the college and Senator McGuire to talk about what kind of certification programs we can do for paramedics. We're going to have on February 5th that meeting in Covelo. And if Jen from Coastal Valleys wants to attend, or Brian, you're very much welcome. Okay? And so that's the plan we have.
And so then I wonder, we report back on February 4th and say, here is our plan for community outreach, town hall workshop, whatever it is. Meanwhile, on February 5th, you'll be having a meeting on how do we fix Covelo. It kind of seems like at some point, all that information what you learn on February 5th might be part of what will inform that workshop or town hall that we will be reporting back on. So maybe we're just coming back with a time frame of when we would be holding this
Exactly,
larger
yeah.
community meeting. And part of what the info you acquire on February 5th would also go to informing that workshop or community meeting.
Right.
Right?
Okay?
Okay.
Are we in agreement then?
Yes.
Okay, very good. All right, moving on to item 6C. And we have dealt with this in part. But discussion and possible action regarding formal request for a subsidy price estimate from Mendocino Coast Healthcare District transferable to Adventist Health for one advanced life support ambulance to be used primarily for the 101 corridor in collaboration with Coastal Valley's EMS agency for 911 responses and inter-facility transfers as appropriate. Supervisor Williams.
So I would still like to ask Mendocino Coast Healthcare District as a favor, given that they're a public entity running a public ambulance service, to look at what they do on the coast and how it might translate to the 101 corridor. And if they can tell us that they think the numbers will work out in a way that the service would break even or generate revenue, I think that would be an important data point for us in our planning. It's not to move forward and contract, but it's just as a favor to get that information from some experts, given that it's working with another government body. I think it's appropriate rather than lean on their staff to make a formal request.
Is that something you could do in the EMCC?
Well, we could, but we couldn't. We certainly couldn't do it officially as the Board of Supervisors. And so I would appreciate approval on this or similar language. If you want to strike transferable to Adventist Health, I'm totally fine with that. The reason I added that clause was we didn't know when this work would be done, and I don't want it to end simply because the hospital operations are assumed by a private hospital company.
Okay. Supervisor Jurdy.
I think there's good value in having that information, and I just would remind us that we did, all 5 of us, vote on a budget in June, and there was no proposal by any supervisor to carve out additional money for ambulance service. We also had $5.4 million of one-time carry forward money, and I don't believe there was a proposal by any supervisor to spend any of that money on ambulance service. But I think clearly there will be some amount of money that's at this point unknown to provide some sort of patch to the system. And so if there is value in just having a straw vote of the board saying, are you willing to provide some supplemental money for ambulance service, I would indicate yes. In a straw vote, yes. But I think at this point we don't have a proposal, so it's too early to know how much and to whom it goes.
Supervisor McCowan.
Thank you, Mr. Chair. We also don't have an agenda item that would call for our opinion on would we provide a subsidy beyond the subsidy that we currently do provide. People keep forgetting that. For probably 5 years we've been subsidizing ambulance service in rural areas. This information, again, I think it would be valuable, but I also think it would be the type of information that would feed into the countywide ambulance study that the city of Ukiah is contracted for. So I don't know why we would ask one provider over another necessarily. I'm still a little concerned about the appearance of the way this is written. It certainly seems to favor one provider over all others, and so I'm hesitant about that. But I think we all want the information to come forward, and it would seem that the community meeting we're talking about, as well as the City of Ukiah ambulance study, would be the appropriate venues for that.
Supervisor Williams.
Let's see if we can compromise on the item. Would the board support giving the ad hoc the authority to make requests of various ambulance companies to collect data to bring back to the full board? Including, I would think it would include this item that we might ask an ambulance provider in one part of the county, would you mind helping us understand, could you break even on another part of the county? If not, why? And maybe pose those questions in multiple directions so that we can start issue spotting and figuring out, is there a model that would self-fund, or do we definitely need a subsidy? If the answers we get back are, yeah, we think we could do it and it wouldn't cost anything, that's valuable. If what we hear is, no, you would need to subsidize, say in the case of Covelo, if we ask a couple of providers, could you do business in Covelo without a subsidy, and they say no, I think that's valuable to bring back to the full board.
Supervisor McCowan.
Well, thank you, Mr. Chair. Again, I think we want the information, but I think we have to be careful about how we acquire that information. And you keep going back to let's ask this one provider. It'd make at least as much sense to ask the current provider on the 101 corridor who's been providing the service for over 80 years, it sounds like. And I would appreciate it if we could go back to County Council to see, after all this discussion, is there some concern over asking for specific estimates from specific providers? Does that potentially compromise the flexibility of the county and what direction it may go going forward? So, you know, I'd appreciate it if we could see if County Council has any thoughts.
County Council?
Thank you, Mr. Chair. And I understand the proposal is sort of evolving, but as I understand it, it's still the concept of asking for some information in terms of an estimate as to the amount of money that would be needed to provide a service under a contract at some point in the future, with the idea that it would at some point be contracted for. I think the thing to be careful about is to the extent that you're asking for specific information or specific numbers from a potential provider on a future competitive process or a future RFP, that there is some potential to either restrict your options somewhat by eliminating potential bidders, or to put in a little bit of potential vulnerability or complication in terms of the competitive process.
Okay. Supervisor Williams.
For County Council, would you be more comfortable with us asking all of the ALS providers in the county whether they could staff additional units in other parts of the county without a subsidy? We wouldn't get into numbers.
If I may.
Yes.
I do believe that does make it significantly safer. I don't want to say that anything is perfect, but it would certainly mitigate the risk if we're simply talking about can it be done without any sort of subsidy.
Yeah, and not target the question to anyone, but apply it to all. Would you be comfortable with that, Supervisor McCown?
I'm getting closer, but if I may, I think instead of saying what would it take for you to provide a service in another part of the county, what would it take for you to provide additional ambulance service? Because otherwise you're potentially excluding the one operating in a certain area from providing enhanced service in that area.
Okay, Supervisor Williams.
We're getting closer.
This is.
The reason I say another area is I would like to know, I mean, maybe MedStar can help cover Anderson Valley that needs ALS. That would be important data for us.
Maybe they could help cover their existing area though, too.
Maybe can they add one or two more units in their current area? I would think if they could, they already would. Maybe they could, maybe they can't at market rates for paramedics, that you have to pay a premium to get them from out of area. I don't want to get into those details, but I would like to understand, of the existing providers, are any of them willing, if asked, to serve parts of our county that are currently underserved?
Well, if you simply...
Okay, let's look at this. And maybe this is a question that really needs to go back to that EMCC. because we're just, we can ask them all day long, but it's really one of those things that should be hashed out in another setting, I think.
And if I may, Mr. Chair, I think we can put that question on the table Thursday. But again, the question I'm comfortable with is to ask all of the providers, can they provide, would they be able to provide or be interested in providing additional ambulance service, and what would it cost, and would it require a subsidy? That doesn't preclude anybody from offering information on what it would take for them to operate in any particular area.
Second.
Okay, Supervisor Brown.
Thank you, Mr. Chair. And I just saw that the clerk handed you public comment cards, and I think it'd be very appropriate to hear from the public. We might get an answer to the debate, or come up with some type of response from the two supervisors. I bet public comment will put us right on tack.
We're going there, thank you.
Okay.
Yes. All right, we have public comment now. So, Mr. Allman.
Thank you, Chair. I spoke most of mine with item 6B, but on this matter, because it is critical, you know, we're coming up on the summer months and so forth, whatever you decide, I'd certainly suggest that we do a 6-month quick fix while we talk about what kind of solution it's going to be. And whether it's MedStar or whether it's the Fort Bragg ambulance, let's get somebody who's going to commit to being up in the north part of the corridor for as soon as possible, and then we can have a conversation, almost an academic conversation, on how we're going to solve the problem. Thank you.
Okay, Dr. Matheson.
I made most of my comments at the beginning. I agree with Mr. Allman. We got to get a quick fix, a Band-Aid on this situation while we think about the long-term solutions.
Okay, thank you.
Teresa Gowan, MedStar Ambulance. I just want to address Anderson Valley really quick. Currently, we do have an MOU with Anderson Valley, and that's how they receive the funding from the ALS enhancement, where when we do have a paramedic available, we do provide the paramedic services to Anderson Valley. Before we started staffing more in Ukiah, it was more available. It has been not as often. Since December 1st, I will have a paramedic back in there on Saturday for a 24-hour shift, possibly a 36 if they would like it. But even on my days off, which are very few, I will respond to calls in Anderson Valley. So Anderson Valley does have some augmented services in their area. It's not what it should be, but they are receiving some ALS services to the community with the MOU that we currently have in place with them.
Okay, thank you. Oh, Supervisor
What
Williams.
what percent of the time is Anderson Valley covered with ALS today?
Well, when I'm home, I may not be on.
Sure,
The,
but what-
you know, when I hear a call go out that is an ALS call, I will respond to that call.
Half the time, 10%?
I would say I'm home pretty much half the time right now. And like I said, they will be getting that paramedic back on this Saturday. And as soon as I'm starting to get a little bit more staffing on Saturdays, because that is their preferred day for ALS services, then they will start getting that paramedic back into the valley more often. It's just, like I said, getting the paramedics into the seats. It's not just putting ambulances, because we do have ambulances available to staff, just no staffing for them.
Supervisor McCowan?
Well, I see Chief Avila coming forward, and I think some of us in the room are psychic, because just before Teresa Gowan spoke, I was going to ask about Anderson Valley and invite you to come forward, because have all this focus on Covelo right now, but Anderson Valley is pretty critical also.
It is. So Andres Avila, Fire Chief, Anderson Valley. Thank you for bringing this up, and Teresa has been phenomenal when she's there. Anderson Valley is a BLS service. We keep talking about paramedic. We have a certain amount of paramedics, we want to deliver life-saving care. In Anderson Valley, it's BLS. I've heard people say, we have one ambulance left in the 101 corridor. That's one paramedic ambulance. I've heard people also refer to when you have a BLS ambulance, it's half an ambulance. Anderson Valley runs on multiple volunteers. We have about 20. An EMT goes in the attendant seat, and then the driver is not even an EMT. We're running on even less than half. We're could be considered a quarter. We run a district that is approximately from the Sonoma County line to the Willits first exit, or equivalent to south coast of the Sonoma County line to the Navarro Bridge. We have a tremendous amount of area, and we have what some people would consider a quarter of an ambulance. We do not have adequate service there. We do not have enough service there. When Teresa's there, it's wonderful. But we need to make sure that when you have a heart attack, you don't have to choose which day it is. We want to have sustainable and quality service in our district, and we currently do not have that. So thank you to Teresa for everything she does when she's there, but we don't need people to choose when and what day they have their medical aids on. Thank you.
If
Supervisor
I get in a wreck on 128 near Yorkville, say a deer jumps in front of me, am I getting pain meds?
At this point, no. Today, no.
So can you explain what BLS is? Not everybody is on the same.
In short, it's a non-invasive type of treatment. We can do things like, assess a patient. We can give them O2. With the expanded scope, we can do things that maybe help people with, say, congestive heart failure, things of that nature, which has been a good feature to have these new scopes. But we can't give the pain drugs. We can't do intubations, no, IVs, things of that nature, which are critical when time, when a call needs it. So as far as having life-saving capabilities, we can do some interventions, but when it really, when people really need it, you need that ALS.
How long have you been involved in trying to correct this ambulance concern?
The Fitch study was on my desk when I took the job.
And do you think
changed.
have we made progress?
With the subsidies of the ALS funding, which I thank the whole board for, we've been able to stipend our volunteers $30 for 12-hour shifts. There's 4 people per day that get a $30 stipend.
Are we in better condition today than we were back when you started?
No.
And last, what do you think we could do different this time? Not attributing any culpability, but we don't want to repeat mistakes that have been made in past years that have left us.
I've heard, repeating the same mistake multiple times is the definition of insanity. Yeah. I think we're going down the road of repeating the same mistakes. I think that we need to do what they're talking about, augment the inland with what they need. I've heard multiple chiefs talk about not having service within the amount of time they need. But we also need to focus heavily on the rural areas. Laytonville, Covelo, and Anderson Valley, if we were augmented, we would then be able to help our neighbors. I know we would be able to reach out to Elk, Comshy. We would even be able to help with system status management to the interior of inland. When we have our second ambulance, we'd still be able to cover it with the manner we have it now. So we would be able to help by those 3 ways. Helping Anderson Valley, Laytonville, and Covelo, and then again, any little subsidies you could do for the interior.
Okay. All right, very good. Thank you. Any other public comment?
David Wheat, Coast Hospital again. So I'd just like to say that the EMCC was never a formally recognized body as a reporting body to the Board of Supervisors, and we're going through the process of becoming a formalized body so that we can report to you. That's just coming together. We've all just applied for the positions. We've registered with the county clerk. This is our first meeting that you're trying to party crash, as it were. So it's likely to be a little chaotic. Just a heads up. So we're going to be meeting about the Brown Act rules and the rules of how to conduct a meeting in accordance. It's going to be a challenging time to get real answers out of that committee. I think they are they have the knowledge base and they have the information, and they can come up with solutions to this problem in a meaningful way. But we're just getting going. So have mercy.
Okay, thank you.
We're used to chaos.
Okay, any other public comment? Chief Carberry.
Good afternoon, Board. I just need to clarify for the taxpayers of Laytonville that when our ALS ambulance is sitting at Highway 162, staging at level 0, that we take our volunteers and upstaff our second ambulance as a BLS ambulance. So our area is covered, even though we're not exactly in town. So just so for the taxpayers that are watching, we gotcha.
Okay, thank you. Any other public comment?
Thank you, Chair, Hashtag members of the board. I just want to make one recommendation to your board today. As your EMS staff, I think it would be a good decision to direct staff to conduct an updated fiscal analysis of the current EMS system. I am confident that that's something we could get done rather quickly with this conversation today. I've already been reaching out to providers as I've been listening to this discussion evolve. But really, I think an updated fiscal analysis on the current system conditions is a very important driving force for the EMS ad hoc and the EMCC committee to work with as we look at our ongoing system structure.
Thank you.
Thank you.
Right.
If I may,
Supervisor McCowan.
question. and sorry not to be a little quicker on the draw there, but would it be appropriate to also direct you to do at least a thumbnail study of what might system enhancements cost?
We'd be happy to do that. I'm taking any and all staff direction today to improve the EMS system in Mendocino County.
Okay, thank you.
Thank you.
Any other public comment? Okay, seeing none, it's back to the board.
I'm ready for McCowan to make a motion.
I'll second yours.
Well, it sounded like a motion was made by Coastal Valley. Anyone want to take that up?
I move we direct Coastal Valleys to perform a fiscal analysis of the current system and potential enhancements.
I'll second the motion.
Okay, very good. Any further comment? Okay, we're going to vote by the button. Okay. Very good.
The motion carries unanimously.
Thank you for that help on that motion.
And if I may, Mr. Chair, I think this has really been an excellent discussion, and I think one thing that it's made clear is that the EMS system is very complicated here in the county. I also think it's made clear that despite the challenges of a relatively poor rural county, geographically dispersed, low population base, the people who are working within the system, the hands-on, on-the-ground people, are doing, I would say, an exceptional job with the available resources. So I think, there's a lot of moving pieces here, but the people doing the work overall are really serving the public well. And it's not that we couldn't do more with more resources. We're fortunate to have the people that we have doing the work they're doing. Thank you.
Supervisor Williams.
Yeah, final comment. As much as I'm after improving the system, I think there's value in working through this process to build transparency, to convey to the public what they can expect. Today, people who haven't called 911 don't understand what a reasonable expectation may be, and it varies greatly throughout the county. There are some cases, I think about myself or my family, where I would want to go to the nearest facility. There are some cases where I would wait for an ambulance. There are some other situations where I would prefer somebody drive me because I know how far out I am and that I'm going to get to the hospital before the ambulance ever gets to me. And I know that raises, liability for first responders, and you want proper packaging and to follow protocol. But being realistic in a rural area, I think there's value in the public understanding how to better balance those trade-offs. And, if you tell me there's no ambulance available, I'll have my neighbor drive me to the hospital. That's better than having me wait 2 hours not knowing what's going on. So even if we don't fund the system to improve it, just building that transparency is a gain over where we're at today.
Okay, thank you. And I think it was a very worthwhile discussion. We've spent over 2 hours on it, and I think that we did come away with some tangible, steps that we're going to take.
Are you calling the 420 rule?
So anyway, yeah. Okay, any other comments from the board?
Yes, he just embarrassed me because I didn't know what I said that time. But I sure heard about it.
Okay. So it's, as Supervisor Williams said, it's 4:20, and I'm going to call this meeting adjourned.